Monkeypox is a zoonotic virus which transmits disease from animals to humans. Cases typically occur near tropical rainforests where animals that carry the virus live. Monkeypox naturally occurs in Africa, especially in West and Central African nations. Cases in the US are rare and associated with international travel from places where the disease is more common. What are the symptoms? Symptoms include fever, headaches, swellings, back pain, aching muscles. Once the fever breaks, a rash can develop, often beginning on the face, then spreading to other parts of the body, most commonly the palms of the hands and soles of the feet. The rash, which can be extremely itchy or painful, changes and goes through different stages before finally forming a scab, which later falls off. The lesions can cause scarring. Does monkeypox cause death? The illness typically lasts for 2 to 4 weeks. Monkeypox can sometimes be more severe. However, it has been reported to have caused deaths in West Africa. How is it transmitted? You can catch monkeypox from an infected animal if you are bitten or you touch its blood, body fluids, spots, blisters, or scabs. It may also be possible to catch monkeypox by eating meat from an infected animal from Central or West Africa that has not been cooked thoroughly, or by touching other products from infected animals, such as animal skin or fur. Monkeypox can also spread from one person to person through touching clothing, bedding, or towels used by someone with the monkeypox rash. Touching monkeypox skin blisters or scabs, including during sex. The coughs or sneezes of a person with the monkeypox rash. Treatment for monkeypox is mainly supportive. The illness is usually mild, and most of those infected will recover within a few weeks without treatment. Vaccination against smallpox can be used for both pre and post-exposure and is up to 85% effective in preventing monkeypox. People vaccinated against smallpox in childhood may experience a milder disease. Infection prevention and control. Prevention of transmission of infection by respiratory and contact routes is required. Appropriate respiratory isolation is essential for suspected and confirmed cases. According to the UK Health Security Agency, smallpox vaccine, cidofovir and tecovirimat as antiviral drugs can be used to control outbreaks. Thank you for watching. Please remember to like and subscribe to help us keep bringing you this everyday knowledge.